Having stage 4 lung cancer doesn't mean that you don't have options, but it does mean that you need a treatment that treats the whole body, and you need to sequence those systemic treatments with local treatments to keep you feeling well and for the cancer to be controlled for as long as possible. So what is stage 4 lung cancer? Stage 4 lung cancer is when the cancer that started in the lung has spread through the lymphatic system or the bloodstream to other parts of the body. The common places that lung cancer spreads to are the bones, other parts of the lung, the liver, lymph nodes, adrenal glands and the brain. All of your staging investigations are to look for those sites and to confirm if they're involved with cancer or not. Sometimes we do an additional biopsy of a metastatic site if we're unsure whether it's cancer involvement or not, because obviously having stage 4 lung cancer means you need different treatment to if you have an earlier stage of disease. So what are your treatment options? Now, I'm very mindful not to use the word cure when we're talking about stage 4 lung cancer, but what I can say is in my clinic I've got a number of patients in whom, because we've sequenced the treatments combining systemic treatment, drug treatment with local treatments like radiotherapy, they are alive and have a cancer that's controlled and not causing problems for a number of years after diagnosis. That's not the case for everybody, and you need to be working with your team to be monitoring your response to treatment and change things up as soon as things aren't working. At the point of diagnosis, you'll have had a biopsy or a blood test to look at the individual genetic signature of your cancer. We use that to make a treatment recommendation. If you've got a driver mutation, something like an EGFR or an ALK mutation, then you'd be on tablets that aim to target and control that signaling pathway in the cancer cell. That can shrink, control, contain the cancer for a significant amount of time. Conversely, you might have chemotherapy combined with immunotherapy or immunotherapy alone. Immunotherapy encourages your immune system to attack the cancer by stopping the cancer cells switching off that white blood cell as it tries to attack and destroy the cancer cell. I see a huge spectrum of responses to these treatments in my clinic. Unfortunately, I can't predict who's going to respond very well to the treatment that I give very accurately, but what I do promise is that your oncologist will be checking for that response regularly, changing things if needed, and also sequencing treatments appropriately. So what do I mean by that? What I mean is if you're having successful treatment with a drug like osimertinib or pembrolizumab and your cancer is mainly controlled but 1 or 2 sites start to grow, you should speak to your doctor about having stereotactic radiotherapy to those sites that are growing rather than changing your treatment. Why am I saying that? I'm saying it because with anybody with metastatic cancer, there are only a certain number of drug options that we have to control the cancer. So if you're on a treatment that's largely working, don't change that treatment to go to your next treatment option when you have another treatment that can keep you on that treatment for longer. The longer you stay on each individual treatment, the longer it keeps working, the longer you have with further options down the line to keep your cancer under control for as long as possible. So what's the survival rate with stage 4 lung cancer? Well, as I said, I don't often talk about cure with stage 4 lung cancer, but I do have a number of patients in my clinic, particularly when we've used drugs combined with stereotactic radiotherapy, who are living for a very long time with the cancer controlled. Treatment outcomes for stage 4 lung cancer are better than they've ever been, and in fact, compared to when I was a more junior doctor, the outcomes back then that we're seeing now would have been unimaginable. In stage 4 lung cancer, it's often about learning to live with cancer rather than just surrendering to it. My 2 main pieces of advice for stage 4 lung cancer are: look after your general health. Don't put up with troublesome symptoms. If you're in pain, that affects your quality of life. It can also affect your appetite, which means that you lose weight, and that could mean that you don't tolerate the treatment that we recommend as well. So don't struggle with symptoms, always mention them to your doctor. Treating your symptoms keeps you well and means that we have more treatments that we can offer you. The other thing I would say is if your treatment stops working, think about having another biopsy or another blood test to look at how the genetic signature of your cancer might have changed. That could identify different drugs that weren't accessible beforehand. So to summarise, stage 4 lung cancer is cancer that's learned how to spread through the body. Treatments tend to be drug treatments in the first instance, but need to be combined and sequenced with other treatments as and when needed. Outcomes in stage 4 lung cancer are improving all the time. What's important is that you receive a personalised treatment plan that's based on your cancer's unique genetic signature, but also that focuses on your symptoms and general well-being. I'm Dr. James Wilson. Let's make cancer less confusing.